Hi, my name is Katie Jo Kobabe, and I am doing my second career profile for Marriage and Family 150. And I chose to do my career profile on marriage and family therapy. As a marriage and family therapist, you have the obvious task of counseling with your different clients, and you can counsel as a whole family, as couples, or on an individual basis, depending on the need. You also counsel on a variety of issues, any kind of relationship. So, for example, you could counsel on premarital relations. You could also do couple counseling or separation and divorce counseling, as well as parenting or child relationships. Um, you can also counsel individuals on a variety of different issues from grief or anger, stress, anxiety. There's a whole long list of different things that you can counsel on, but the main focus of marriage and family therapy is to recognize the issue and address it, but also to see how um, family relations and dynamics are playing a role into that. Besides the obvious tasks of counseling, though, marriage and family therapists are required to make sure that they have notes that are clear and concise, and also adequate evaluations of each of the different sessions that you have with your clients. And those need to be recorded and organized. If you're working in a private practice, you are also responsible for marketing and advertising your services to really get your name out there so that you can actually have clients come to you. Um, Marriage and family therapists are also often in charge of billing and working with insurance companies. They also need to be able to work with other health professionals that any of their clients may be working with. So just in general, you need really good listening and communication skills. You also need to be really good at organization. And you also need to be familiar and comfortable with financial and technology skills. Um, you can work in a variety of different environments as a marriage and family therapist. The main groups are either with a government agency, with a group practice, or a private practice. And because of the nature of your work, since you're working or since you are doing services with other individuals, you often need to work around their schedules, which means that you often will work evenings or weekends in order to accommodate your clients. You Although you do have to kind of like work around their schedule because you get to set up your own appointments, sometimes you have a little bit of say in when exactly you're doing hours and when you're not. um, but you will also get holidays off, which is a nice benefit because not everybody gets that. One example of a group that you could work for is the Individual, Family, and Couple Counseling Center, and that's out of Idaho Falls, Idaho. Um, just like with any job, there's typical stressors. For a marriage and family therapist, a lot of it revolves around the fact that you need to have strong confidentiality in your work, which means that you can't talk to family or friends about what you're doing throughout the day, um, because you need to make sure you have that confidentiality with your clients. Um, you also can have stress from things like your clients aren't progressing in the programs that you're setting up, or they're not responding, or they don't want to listen to the suggestions you have, which can be difficult. Um, and sometimes you need to be able to set aside your own beliefs, particularly religious beliefs, to help individuals out to make sure that you're giving them the benefit of what they need to improve their relationships and not necessarily change their belief system. Um, Other stressors can include financial um, strain, depending on how much you're making, or if you're not getting enough clients in, that can add a little bit of pressure to your life and your situation. If you are interested in becoming a marriage and family therapist, you need to make sure that you get your master's um, in some kind of counseling field or related area. And then after you complete your master's, you'll go through a 2-year or at least a 2 year supervised counseling. So somebody else will be there with you to make sure that everything is going smoothly and you're up to standard. And then after you've completed that supervised training, you will need to pass a state exam to become licensed in the area that you'll be working in. Once you become a marriage and family therapist, you can make anywhere from $25,500 a year all the way up to about a little over $75,000. But I found that the average pay for a marriage and family therapist is a little over $49,000 a year, which is not a ton, but definitely enough to meet your needs in most areas. As a marriage and family therapist, you typically receive health insurance, life insurance, and disability insurance, as well as paid holidays and vacation, and you often have some kind of pension plan set up. Other than that, I have found that it is definitely a growing profession. So you'll have a lot of job security, and even the Occupational Outlook Handbook has predicted that there will be about a 41% growth from 2010 to the year 2020. So definitely job security if you want to become a marriage and family therapist. Anyway, I hope that you've been able to learn something more about family therapy, and thanks for listening.